Hi, I'm Rhonda Massa from the West Island blog, and I am here with a reputable doctor to talk about Bell Talks Day and communicate about mental health issues to help alleviate the stigma around those issues. Dr. Lalla, nice to have you.
Thank you, it's great to be here.
Dr. Lalla is a psychiatrist and he's co-chair of the foundation, the Lakeshore General Hospital Foundation. Let's delve right in. If I have mental health issues, or I suspect a family member has mental health issues, how do I go about a solution? Where are my resources? These are the things I'm looking to discover today for the West Island in particular.
It really depends on the issue, but for the most part with emotional problems, what's nice is that in Quebec we have a better network in terms of catching people and helping them to get the services that they need. So there are also always the hospital emergency rooms where there's psychiatrists who are on, do coverage or on call all the time and help shunt people into the proper evaluations and services that are available in the second line, so the departments of psychiatry. Additionally, there are every sector of Quebec now has crisis center coverage, so that if you believe that you're having anxiety or panics or a variety of different things that are due to a stress in your environment, whether it's a divorce, other kinds of problems, we have in the West Island our own crisis center, and it goes by different names at different parts of the city. So downtown it's Tracom. Here we have, it's called the Crisis Center. And their number is 684-6160.
They literally have beds.
They are the sister institution to the Department of Psychiatry here in the West Island, and they have beds where individuals can stay for a week, and they can help facilitate getting you to an emergency room or getting you certainly to get the services that you need. Certainly if you are feeling suicidal, you should present right away to the emergency room. That's the resource for acute issues involving people who lose touch with reality, individuals who are very depressed and suicidal.
Are people like that generally in the mood to go to the ER?
Generally they are. Generally what our studies and our work has shown is that it's rare that individuals who are actively suicidal fight going to the emergency room. All they need is help. So that's part of what's interesting about the Bell Talks campaign, because a lot of people suffer silently, they're embarrassed, and once they reach out, they get what they need.
So reaching
and they don't fight it usually, yeah.
Reaching out, family members, support, any ideas where people can go, clergymen, a variety of options that are available?
There are a variety of options. So in terms of you yourself, if you feel that you're in a life crisis, you're going through something terrible in terms of stress, someplace like the Crisis Center is available. If it's more serious than that, there's our hospital emergency room. If you're concerned about a loved one who is showing strange symptoms or is not accepting necessarily of help or health, you can call an institution that we have that's run out of Dorval called Friends for Mental Health. They have been instrumental in helping families cope with individuals who are either refusing help or can't get help, or showing strange symptoms, or for whom the family members are perturbed enough. So they do help out. They help educate family members about different things they can do to confront their loved one who might be in crisis, or
who's not necessarily admitting their crisis.
That's correct.
Or ready to admit their crisis.
That's correct.
Okay, so Friends for Mental Health is where I would go for that.
That's a great organization. So individually, the Crisis Center and the emergency room are very, very good resources to get counseling, to get resources, etc. And if you have a loved one that you think needs resources and is either refusing them or doesn't know where to go, Friends for Mental Health that you can call is an excellent.
What about Foster's Pavilion? Tell me about that.
Foster Pavilion, we are very blessed to have them here in the West Island. They are an organization that has offices across the Greater Montreal, just north of Montreal and just south of Montreal, and they help individuals who are interested in dealing with their difficulties with alcohol or drugs. They also have inpatient services for individuals who are detoxing from a variety of compounds or alcohol and need that service, and they have excellent outpatient services, group and individual, that they offer on the premises of the Department of Psychiatry at the Lakeshore Hospital. So we're very lucky to have them, and they offer an A1 service.
Phone number for them is 630-2225, extension 4100. I will be posting all that with the information above, so don't worry about taking notes right now. Support groups are one way to go. What do I do if I have a youth who has a problem? I know there's a hotline. It's 1-800-668-6868. That's if you're a youth and you are struggling.
That's it. The Kids Health Line has a very positive history in Quebec. They've done great fundraising. They offer great listening resources. A lot of corporations in Quebec have recognized how very, very important they are in the support that they offer to our young people. So they're they're a great reputable support organization that can get people started on the resources that they need.
There is an app out there called kidshelpphone.ca or Kids Help Phone. That's an app that you can put into your child's phone, and they can directly chat with a live person at any time. Let's be honest, that's the way
That's the
children are
way to go,
communicating.
yes.
So we're communicating. There is an app out there if you're in trouble and you want to talk and you don't want to talk to your parents and you don't feel comfortable talking to anybody around you. This is a place for you. I will again include that in the text. Local support groups, we've covered that. The CMHA, can you tell me about that?
The CMHA has chapters across Canada. Their bilingual chapter here in Quebec is also very well established. They offer some of this, depending on which parts of Montreal you're in, it's the CMHA chapters that will offer you what you need in terms of a loved one for education, in terms of getting a loved one help, or things that you can do. The West Island equivalent is more Friends for Mental Health, but very well recognized. They have a link with AMI Quebec, and I think it's AMI Quebec who gives also their Francophone services for the greater Montreal region. So we are, can we have more resources with respect to mental health? Of course. It's only been, I think, in the last 20 years that we've started to realize, hey, 15% of the population at one point in their lives gets clinically severely depressed. A certain, percentage of the population will have a suicidal act, and it's quite huge in Quebec. In 2010, 1 million workers out in the community in Canada suffered from depression. So it is a very, very big topic. We know now that depression is a huge risk factor for sudden death, for cardiac disease, and having through mechanisms we don't even understand. Mental illness really is a risk factor for a whole lot of stuff. Having one untreated depression episode means that you have an almost assured probability of having another one in the near future. So it's a really valid medical specialty, not just because I'm in it. It really is linked so much with body and mind and immunity. And yes, we're in the midst of proving as well that if you don't take care of your mental health concerns, your risk of illnesses such as cancer are very much elevated as well. So it's an exciting time. There's so much we can do, and we have been the poor brother or child of medicine for a long time, but that's changing, and I'm very happy to see it's changing.
So walk me through it. I feel depressed. I don't know the level of depression that brings me to your office. I don't know whether I'm worthy of that. I can imagine feeling like embarrassed to come because am I being ridiculous? Because there's no open wound. I can't see what I'm feeling. I don't know if it's a 10 or if it's a 4. I've never felt depressed before. Is it real depression? How do I take myself from being at home crying in fetal position to you and moving forward from there? What does that journey look like?
Well, certainly because of the organizations that we have and the instruction and knowledge base that's being given to our family doctors and specialists in the community, you don't necessarily have to see a psychiatrist for that right away. It's not that there are very few of us in psychiatry, but we deal as well primarily a lot of time with cases of people who do not respond to regular treatment, who do not have the regular resources. Generally, we call them the first line resources that are available for individuals who suffer from something like a depression would be firstly stuff like the crisis center, your employee assistance program at work. Many large Quebec corporations have an employee assistance program that give them education and the start of therapy.
Wouldn't that give me stigma at work?
Well, no, it's confidential.
Okay.
All employee assistance programs are completely confidential. So that's not, a vantage point. The other thing is so visiting your family doctor and making sure that they know about it. Having offices like the Crisis Center and the Employee Assistance Program in on that as well. That's a good first step to work on. Our first line services right now also have what we call a guichet d'accès, which means that individuals can call their neighborhood CLSC to say, I think I'm having a mental health problem, who do I talk to? And they put you in contact with a mental health nurse. So you see, this is much better than it was even 10 years ago, because between these 3 or 4, you're covering the medical aspect, the family support aspect, the therapy aspect. So I tell people as much as possible to make use of all 4 of these. Thereafter, if treatment is not progressing where people want, or there is not enough headway in terms of people returning to function, another interesting thing is we now use function as the real indicator as to whether somebody is getting better, not just the sadness. People don't do badly in the workplace because they're sad. They don't do badly in the workplace because they can't function, and that involves all factors of the depression. So if we can't get people back to functioning, then that's when they come to the second line, which would be our Department of Psychiatry, to make sure that subspecialized resources, treatments, and support is offered.
Is that all covered on Medicare?
It's all covered on Medicare, and depending who you work for, more of your meds, services, and therapies might be covered as well. And the coverage for mental health services for private corporations in Quebec is quite good.
Okay. Do you have anything else you want to add?
No, don't. Certainly to tell people don't need to suffer alone. So much of the population will have what we call a mental illness issue, that we want to empower people to get better. We want to give them that support, and these resources really do care. I've seen them in action, and I've helped some of them to grow over the last 20 years. So it's an exciting time in mental health, and it's a time that we can catch people early.
Okay, thank you so much.
Pleasure.
Thank you to Dr. Lalla for joining us today on Bell Talks Mental Health Awareness Day. All the information that you need will be in this post, so the numbers are there. Don't hesitate. If you are young and you are looking for help, 1-800-668-6868 is that hotline, and you can install the app on your phone, kidshelpphone.ca, or just the app itself. Thank you, and have a great Bell Talks Day.